Fingertips above the water, you watched me drown. You could have saved me, but you let me down, yeah.
Doctor, thanks for being here.
Thank you for having me. This is awesome.
Yeah, I'm really excited. Your TED Talk was very impactful on me because selfishly throughout my life, whether it's presentations, interviews, and so forth, I've not been in the best control of my voice. Real confident guy, I like to think I am, but at times my voice has failed me probably because of my crazy brain or my emotions and so forth. So hearing someone articulate on that and answer some questions for me was enticing, and very glad you're here today.
Cool.
Yeah, we're gonna get down and get into it. So if we can, let me just start off with something that I found fascinating in that TED Talk. A very simple statement, but it opened up the door for me and maybe a lot of other people too. Yeah. You said our negative emotions affect our voice. Now, maybe it sounds simple, but if you really think about it, that's hugely impactful all day long, every day. Am I right?
You're totally right. You're totally right. So, do you want to know why?
Yeah, I want to know why.
All right. So, our vocal folds, otherwise known as vocal cords, the reason that we have them is they protect us. And they protect us. They sit right on top of our windpipe, horizontally right on top of our windpipe. And they protect us from swallowing down the wrong tube. That's the number one thing. So we don't choke, okay? That's the evolution side of it.
Okay.
But they also protect us from our negative thoughts, from our ruminating, worrying, anxiety sort of thing.
Okay.
And we know this from animal studies. So we know this now in human studies by sticking electrodes in the vocal folds and around the throat, that if we're scared, either a loud startle noise or we're getting ready to do a public speaking event, that the vocal folds tense, and sometimes they completely close. So if you're, this is a kind of morbid thing to say, but we're sitting here in this studio and all of a sudden a plane crashes the studio. We know three things would happen. We'd blink, our heart rate would go up, and we'd hold our breath.
We'd hold our breath. I get the first two, but you know we're going to hold our breath.
We're going to hold our breath. So have you ever heard these sayings, I couldn't scream for help?
Yes.
Yes. Have you ever heard these sayings, another one is, I get all choked up? Because as the vocal folds are actually connected to our limbic system in our brain, that controls our emotions. And so there's a sensory feel and there's a motor component to voice control that is linked. And I'll give you a real world example. When I was in undergraduate, I'm from Canada. I was at Queen's University. And I was in final exams, and I had a roommate. She was at the front of our apartment, and I was in the back room of our apartment. And I'm studying and everything. And I had a couple of headaches going on. I'm not a headachy person.
Right.
And I was like, I'm stressed, whatever. And then I started getting tingles up my arms. And I thought, okay, this is not right. Something is very wrong. I'm going to go to a doctor. I need a CAT scan. Something's going on. So I went to the doctor, and I knew I was stressed. Exams. My boyfriend had just broken up with me right before exams. So I got that. And so I'm thinking that something's really wrong with me. And the doctor said, do you sigh a lot? And I remember this because I was actually angry. I'm like, what? I think something's wrong with me and you're asking me if I sigh a lot? And he said, yeah, I'm asking you if you sigh a lot. And I'm like, no, I don't sigh a lot. And he said, well, do me a favor, go back to your housemates or whoever you're staying with and ask them. So Lisa Parker North now, I'm still we're still friends. I went to her and I was like, hey, Lisa, the doc wants me to ask you if I sigh a lot. And she's very introverted, and she started laughing hysterically. And she's like, oh my God, when you're stressed, all I hear you doing is sighing. And I was like, really? So sighing is a symptom of breath holding.
How about that?
So Respiration 101 is we breathe in oxygen and we breathe out carbon dioxide. But if we hold our breath when we're thinking, when we're worrying, when we're stressed, it builds up and it comes out in a sigh. So then I went downstairs and I had two really good friends, still friends with them, two brothers, Mark and Mike. And I said, hey guys, the doctor wants to know if you guys think that I sigh a lot. And they said the same thing. And then my one friend, Mark, he's like, and you walk on your heels. So evidently, I was this stress sighing heel walker, and I had no idea.
Right,
so it's rampant.
Right.
So next time you're thinking about something, just check in and go, hey, am I holding? A lot of people hold their tension with their vocal folds in their neck.
I think I do that. Yeah, I think I can actually admit I know that I do that.
Yeah, so it's very powerful once you talk with patients about this and make them aware, because that's really what I do. Is I'm a big awareness. I tell my patients I'm a big mirror with ears, and my job is to make you aware of your isms, and we all have them.
Yeah.
And once they're aware of it, you exhale.
Right. So let me ask you this: are you a believer in meditation?
Oh yeah, absolutely.
Okay, because that would be a way to teach yourself to correct that awkward breathing or that non-productive breathing, right?
Yes, I love it, and meditation and mindfulness, totally, 100%. But when we're not in that mindfulness mode and we're driving or we're sitting across a colleague who we know doesn't really like us and is
can't meditate.
Yeah, you can't meditate, exactly. And
you can,
but you can't.
A little awkward, yeah.
It's a little awkward. But what you can do is just release and exhale.
Yeah.
And be aware of it.
Yeah.
So it's kind of, and so how this negativity comes through our vocal folds is it tenses it up, it tenses our vocal folds.
Right.
And when our vocal folds tense, it sounds strained, and sometimes I can maybe go into some glottal fry like this, and that's giving my voice away. And a lot of people, they just become a little breathless, and their pitch goes up, and they do a lot of uptalk. At the end of the phrases, they go up in their pitch, and it makes them sounds like they're insecure, so their voice is giving them away.
Yeah, that's not good in business. Yeah, that's something to try to really hone in and correct if possible. Work on that.
Yeah,
I would think.
Absolutely.
Especially in sales and negotiations, you want to be able to. That's a tell to someone who's educated on the other side of the table. Right? Am I right?
Yeah, absolutely.
That's a tell that there's nervousness, that they've struck a chord, and no pun intended, struck a chord in you somehow that's affected you in a way.
Yeah, absolutely. Yeah. So in a way, are we nervous? Of course we're nervous, but can we teach people to mask that? Yes.
Really?
Yeah, absolutely.
I want to share this with you.
Yeah.
Let me take a moment. Was in a job 30 years ago. I was accused of doing something I did not do, but I had no way of proving my innocence. So I knew I was going to be called into a meeting with my superiors, and one defending me, one trying to get me fired. And I really was but the most compromised I probably have ever been in a business setting in my young life at that point.
Yes.
They threw all this on the table, and I systematically started putting it together. How I'm going to defend myself on this, and this. I could not speak. My mouth went completely dry. I almost felt like my vocal cords would not work. It made me look really guilty. And had I not had my ducks in a row and had the facts on my side, but it was harder to get my point across because I could not effectively speak at all. Like I needed water. I had never gone into, quote, like vocal shutdown mode, but boy, it made you look in a way that it made me look in a way that I really wasn't. That left and that, and here's just 30 years ago, I'm telling you this. I remember it as 1990s, as pure as it happened yesterday. It was horrifying.
Right. Exactly. And that happens, and that is normal. It is our body's way of protecting us. The only problem is it makes us sound bad.
It does.
And then we get judged. And especially, podcast in this virtual voice world
Right.
that we're in now.
Right.
People don't do face-to-face so much. You know, you do the phone interviews, the screenings and all that. So it's really, really important. And working with patients, I guess this is one thing that I want the listenership to listen or to hear, is that it doesn't take long. It doesn't take long. 2 to 3 sessions. Usually, if there's not a voice disorder component to it,
Right.
with healthy speakers, normal larynx and everything, 2 to 3 sessions. And the other thing is, when we're nervous, all of a sudden we become a victim of our physiology, right? Because
Absolutely.
our fight and flight, system, our sympathetic nervous system is like, rah, 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 and we're victim.
Right.
But by working with people, we give them something to do. And when you give them something to do, and I'll give you 2 little things right now, is coast on the consonants, articulatory precision when you're speaking, and pause.
Let's talk about all 3 of those.
Yeah,
Okay,
sure.
the first one.
Okay.
I'm not even going to try to attempt what you just said, so can you repeat that to me?
Yeah. So one of the things that goes wackadoodle when we're nervous is our respiration.
Right.
Right?
Yes.
We shallow breathe, rapid breathe, and it can come out as like almost, right? Because we're nervous.
Right. Correct.
So, this is one thing that was on my TED Talk, and it was an example, and I want to expand on it a little bit. If you're going into a nerve-wracking situation, the one thing you want to do at the beginning is coordinate your airflow and your voice. It's a really simple thing. We all have a finger, and I call it playing the air string like this. Do that.
Okay.
Okay, so now I want you to hold back your air,
Okay.
tighten up so you don't feel anything, and go, ooh. There's no air there.
That sounds
Just
that's
basically,
natural. Okay.
just hold back your air. Ooh.
Ooh.
Do you feel it more in your neck?
I do.
Okay.
Yeah.
Most people, when they start speaking and they're nervous, they'll feel their neck tense up. They'll get constricted.
Yes,
Okay?
absolutely.
All
What
right.
the veins in our necks come out?
Well, our muscles, they're tightening up. They're not
Right.
letting the air go,
Right.
Another thing that is more of a singer's thing, but if a speaker can do it, great, is doing...
I've seen singers warm up with that.
Yeah. Can you do that?
No.
It's all right. The reason,
sorry.
yeah, it's okay. The reason that it's really good is I call it the double reed instrument. So bassoons and oboes have 2 reeds, and you need more
Interesting.
airflow to go through. So with us, the first reed is the vocal folds vibrating.
Right.
The second reed is our lips flapping.
Got
So it really gets our air moving, because the first thing when we're nervous and our voice starts to quiver, it's like our airflow, which is our support. Right? So then we go into the 4 sounds that are really, I call them like the cash cow sounds. There's a lot of mouthfeel. We go into a whooz. Do that. Whooz. Do you feel that buzz right there?
absolutely.
All of a sudden, you're directing the speaker that you want to feel
Right.
the consonants when you speak. Because
Got
when
it.
you feel the consonants when
Got
you
it.
speak, you're not feeling it in your neck, and you're not holding back that airflow.
You're transferring it to the mouth.
That's right. That's where you want the vibration and the resonance to happen. In singing land, they call it singing in the mask. You want to feel it here. You don't want to feel it in your throat. You want to feel it here.
Huh.
Does that
okay.
make sense?
Yeah, it makes a lot of sense.
Another sound is a V. So then we'll work with patients and we'll say something like, I really want you to feel it here, and say, Vince vow to vote. It's buzzy. It's right
Right.
here.
Right.
It's a totally different sound versus Vince vow to vote.
Because that's coming from the throat.
That's coming through the throat. Or when you're really breathless, Vince vowed to vote.
It never even makes it to the mouth.
Yeah.
Right?
And then it's what? Sorry?
It never even makes it to the mouth. It's all in the throat.
It's in the throat, and it's breathy. So everyone can manipulate their voice, and so it's super exciting. But actually, one of the reasons, but one of the reasons I love what I do is the person behind the voice. The person behind the voice. Because a lot of it, not all of it, but a lot of it is the psychosocial aspect of it. Voice and identity, is your voice congruent with who you really are? All that kind of stuff.
That's pretty deep.
Yeah,
that's
deep.
Oh, that's very deep.
Super deep. In fact, it's so deep that before I got my PhD in speech pathology, communication science, and disorders, I was really thinking of getting it in clinical psychology.
Okay.
And there's a whole niche area of voice, which is voice and emotion. So it's in the purview of voice specialized speech language pathologists with this psychological social part. There's tons of research on it in my field.
Okay.
So yeah, we are not with every patient. Not every patient needs this.
Right.
But there are some patients. I'll give you an example. Last year, I saw a patient with my co-director, Libby Smith, at the University of Pittsburgh Voice Center, UPMC Voice Center. She's our laryngologist. And this patient was actually coming just for a screen. They were getting some shoulder surgery. And the anesthesiologist was like, well, you're whispering. Let's just check out your vocal folds to see everything's cool before we put an endotracheal tube in there, right? So he came in and he was whispering. And he had been whispering for not 8 days, not 8 weeks, not 8 months.
No, you gotta be kidding me.
For 8 years.
Okay.
And the reason I can talk about him is he's on our website and his story is on our website. And so 8 years, that's a long time. And I'll be honest with you, Libby looked at me and she's like, Jackie, you're a patient. And I'm pretty confident in my ability to help people, but I was like, 8 years, what? So after 2 sessions, we coordinated and got his voice back. And, not to go into too much depth and everything, but, on our website, he's like, wow, it totally changed me. And now he's doing radio work.
Incredible.
It's incredible.
Yeah, that's incredible.
So, our voice is us.
8 years. So he's been tense in the throat, in the neck region, in his vocal cords for 8 years. He conditions himself to believe that that's the way he's going to communicate, right? Yeah, he was whispering. But he actually convinced himself that's his normal mode of communication.
Yeah, because he didn't know how to get out of it.
Wow. Oh my gosh.
Super guy, super amazing what he did. And, here's the thing. We diagnosed him with something called muscle tension dysphonia.
Okay.
But, muscle tension dysphonia is when there's no lumps, humps, or bumps, like nodules, polyps, cysts in the vocal folds. There's no paralysis. Everything works as it should.
Right.
But it's just how the patient is functioning, how they're using all of these muscles. There's about 18 pairs of extrinsic, like throat muscles, and then inside the voice box muscles. And they party in groups, right? Muscles party in groups. And for whatever reason, sometimes they just get out of coordination. They get out of balance. So voice therapy, really, Eric, is all about rebalancing. It's basically like teaching someone to ride a bike.
Okay.
But not ride a bike, but use their voice. And so, I don't know, who taught you how to ride a bike?
My father did.
Okay. I highly doubt that your father put you on a chair like this and said, okay, I don't know if the camera can see this, but Eric, I want you to pump your left leg right now. 10 reps. Okay, that's great. Oh my gosh, that's awesome. Now I want you to pump your right leg.
You don't know my father. No, he didn't do that.
Okay, what he did is he just put you on the flipping bike.
Yeah, and pushed me down the street.
Don't fall off, right? And push you down your street, and you and your body. A hill. Okay, maybe now we're going really
School
deep.
Street. No brakes.
No brakes. Okay, all right. But you learned.
Yes, I did.
You learned how to balance.
Absolutely.
And so that's what we teach patients, is how to learn how to balance with their voice, with a little guidance from us.
Okay.
Yeah. So I don't know if that's...
No, that's fascinating to me. Let me throw another nugget out at you and get your response.
Yeah.
So we talked off camera a little bit. The years I was in the guitar business, my biggest client, quasi-client friend, was Paul Stanley of Kiss. We did some work with him.
Yeah.
First time I met him at a show here in Pittsburgh, he was doing a little solo gig out in Greensburg. We're hanging out backstage, which was a thrill. We closed the door because he has to get ready for the show.
Yeah.
So we're standing in the hallway, and it's just a door. It's an old building.
Yeah.
And he goes into these vocal exercises that just skew my opinion of this man. And I'm out in the hallway looking at my buddy Fred. I'm like, what the hell's he doing in there? But it was very similar to things you just explained to me.
Yeah.
And I understood it was a vocal exercise, but it was so bizarre, and then the slowing and the rapid nature and slowing, because we were out there for a couple minutes. I heard the whole exercise.
Right.
But there was a person that was at that time probably in his mid-50s, been doing it for a long time.
Yeah.
And that was his way.
Uh-huh.
And it wasn't just, sex, drugs, and rock and roll, and you're out there just doing your thing. There's a lot that goes on. And I realized at that moment there's a lot more to it than shooting an album cover and being a rock star and all that. You had to take care of your voice. Subsequently, he's had vocal issues. He, I think, had surgery in 2011.
Yep.
Dr. Sugarman out in
LA.
Joe Sugarman. I don't know how that worked for him or not, but I saw something interesting in your presentation in one of the, I think, news articles on you, or news video clips on you, where you were working with, I think, Billy Price and other vocalists in a way to possibly avoid vocal cord surgery. Is that correct?
Oh, 100%. That is our job.
Okay.
As voice specialized speech pathologists and voice specialized, like singing people.
Can we talk about that? Like, what is the determination? At what point do you have to get surgery, and what can you do to avoid surgery?
Yeah. So,
and why is there a problem to begin with? Does that happen over years of abuse? And how does the vocal cords get abused, for that matter?
Yeah. Great. Okay. So
That's a lot there. I know.
Yeah, it's okay. So I'm just deciding where to start. How we get problems on the vocal folds: nodules, polyps, cysts, bleeds. So when I was down at the Vanderbilt Voice Center down in Nashville, and worked with a lot of country music singers, and I can say all these names because they're on the wall. So Faith, Brooks and Dunn, all those guys, Donna Summers. A lot of professional singers have some stuff on their vocal folds. And, I always say to singers, have you ever seen a ballerina's toes? It's like the warrior signs, the battle signs of your chosen career, right? So when surgeries is talked about is when your lesions or whatever you have is now not allowing you to do what you could do. That's when you have surgery. But we try our gosh darndest to keep people away from the knife. And even if they don't have perfectly straight-edged vocal folds that are pearly white in color, can they function? Can they sing around a bump? Billy has a bump, and he's on our website and the video and everything. He's got a bump. And so he can sing around that bump, and he's a soul singer, blues and everything, and that music is a tad forgiving to that. All right. So maybe if he was a tenor singing, I might have a different
opera.
Right, we might have a different story, but as long as he can keep doing what he's doing and not have to touch it, that's the best thing to do. Yeah, it's the best thing to do.
Okay. Now, what are some of the? I'm sure it's very involved, but what are some of the things you can do with the patient are you strengthening their vocal cords, or more about what you were saying before, teaching them to use more of their mouth? I
love that you just said that.
Okay.
So here's the thing. We're known as speech therapists,
right.
And a lot of people, and I think speech therapists, that we're guilty of using this terminology, that we use voice exercises.
Okay.
And so when you say exercise, you think of strengthening.
Okay.
And when you say speech therapy, you think of physical therapy.
Right.
And you go to the gym, or you go to a physical therapist after something's bad has happened, and they put you on a progressive resistant exercise program. So you progressively go from 5 pounds to 10 pounds, right? To build up that strength. We talk about this in voice therapy. We're still, after 35 years, trying to prove that we actually strengthen the vocal folds. We haven't 100% proven it yet.
Okay.
But what we do know that we do is just what you said. You're such a good listener. Is that we direct patients to things: to feel, hear anterior energy, and to not feel it in the neck, and also to hear a difference. So this is something that I do with audiences all the time, going back to the finger phonation. So I'll have people feel the air and go, "Who are you?"
Good song, by the way.
Thank you. And then don't feel the air and go, "Who are you?"
Right.
Do you hear a difference?
Yeah,
lower
absolutely.
pitch,
It's
a little
also
rough,
all coming from
and
here.
it's coming from the throat.
Right,
So
right.
gearing a patient to be able, in a conversation, there's a type of voice therapy that myself and some colleagues designed called conversation training therapy, that while the patient is actually conversing, talking, we're shaping how they sound and how they use their voice when they're talking. Because no one comes into our voice center and goes, "You know what? I just can't hum like I used to," or "I just can't hold out a Z like I used to." They come in saying, "I get hoarse when I'm speaking for a long period of time.
Right.
And then, I've got a throat clear. Sometimes I've got a cough. I get tight."
Huh.
Yeah.
Yeah, you work with Frizzy too, right?
Yes!
Let's just jump into some juicy stuff here with him.
Yeah, the frenzy voice frenzy. It's amazing.
The Frizzy voice frenzy.
So Ryan Seuss, who's one of my
Yeah,
colleagues, he's a sleep specialist.
Right.
I don't know, 3 weeks ago, he called me and he's like, "Jack, I have a patient of mine coming in, and I saw him a couple of years ago, and super good guy, and he's attempting this Guinness World Book of records
Right.
of rapping." And I was like, "Oh, wow, cool. So what's his name?" And I look him up and everything. And so I saw his Mr. Rogers, Emmy. And I was like,
"Did you see him on this show?"
Yes. Well, I did. Of course I did. Don't worry. I did. I listened to him. And that's where, I got to be honest with you. I talked to him yesterday, and I was like, it's really Frizzy the rapper, Frizzy the musician,
No question.
Frizzy the movement. Am I right? Frizzy the movement. Seriously,
I get it.
He's
100%.
He's motivational. Every time I'm with him,
He's a great conversationalist,
I'm
great
quite
motivator.
I'm quite certain I can fly after I'm with him.
Yeah, I totally get it.
You see what I'm saying? So anyways, so I said to Ryan, I was like, "Sure, let's do some scientific stuff." So I met him, and as you know, he's like 6'5".
Yes, he is.
So we immediately bonded, and we went to the voice lab, and we did our acoustic protocol. So measured his voice, looking at, quality, the pitch, the loudness, all that type of stuff. And then I was like, I just want you to freestyle. So then we measured him just freestyle rapping, okay? Then we did something called phonatory aerodynamics, where...
Repeat that again?
Yeah. All it means is we measure the airflow when people speak, right? So he had this mask on, and we did our regular protocol, and then he also did some freestyle rap. And I'm like, cool, okay, got that. And then took him across our hall where we do laryngeal imaging, and I did a flexible scope, to look down at his whole vocal tract and just make sure that everything's moving,
Right.
and there's, again, no humps, lumps, or bumps. Everything's cool. And then with the flexible scope, we have something that's really cool. It's called narrow band imaging. And you can do it in all body parts, but basically what it does is it highlights the vascularity of a body part. And in our, we want to look at the vascularity of the vocal folds. Because if this guy is going to be rapping for 31 hours, we know from physiology with vessels and everything that there's probably going to be something, it sounds like a fancy word, it's called angiogenesis. And what it means is when there's a wound, and I'm not saying that Frizzy, sang in a bad way, but for 31 hours, okay, the vocal folds are shearing, they're vibrating. The body thinks of that as a wound. And when the body has a wound, it calls on blood vessels to be like, hey, we got to go down to the vocal folds here. There's something going on. And so the body creates more vessels.
Got it.
Right? Because they're trying to heal it.
Right.
So anyway, so we did that pre-wrap, and then I did something called its video stroboscopy. It's a xenon light.
What was that?
It's basically, it's like a disco light.
Okay. That's cool.
Yeah, that, in a disco light, it makes you look like you're, dancing in slow motion.
Right.
Well, it makes it look like the vocal folds are vibrating in slow motion.
So you can see what's going on.
So you can see. And the vocal folds are basically, if I use my hand here, so the vocal, or my arm, the vocal folds are a muscle.
Okay.
And over the muscle, there's this mucosal covering. And when we do the strobe light, it allows us to see how this mucosal covering basically slides over the body, the muscle of the vocal fold. And that lies where we get our quality of voice.
Interesting.
And the home sweet home for most lesions is here.
Okay.
So anyways, we did that, and then Frizzy was like, "Hey, would you come to the block and give me, and I gave him some exercises.
Right.
See, I did it again. Exercises. I gave him some vocal balancing tasks that he could do as warm-ups. And then I went on Saturday. It started off at 10 o'clock. And as it went, he had, this is the Guinness book, rules, 5 minutes every hour as a rest. But he's like, I want to go 5 hours, I want to go 6 hours, and then have a big chunk of time where we could work together.
Oh, that's how they permitted him to do that? Okay.
Yeah.
Okay.
So, what is it? I think... I got to look at my notes.
That's okay.
Grind Hard was, shout out to them. They had a simulcast. So he was playing, and you could hear him the whole time, right? So I was there at all the breaks, and we did some balancing tasks using straw phonation, using masks.
Interesting.
Using lip bubbles. We had circumlaryngeal massage here, but let me tell you the biggest thing is he had a steamer.
Okay.
So I went to Target in the morning and I bought him, and I have no money in this, Pure Mist steamer, because drinking water is important. It thins our mucus. But drinking water when you're rapping for 31 hours is not so good because he's got to go to the bathroom.
You think?
Okay? Right? So he was drinking stuff. But the other thing is, when we have our mouth open and we're giving lectures or presentations or rapping for 31 hours, we get something that's called surface dehydration. And that mucosal cover gets dry.
Okay.
And then we sound dry and we crack. So every break we did, he literally, I had a muscle, like one of those massage muscle things on him, and he was steaming.
How about that?
And we were doing our vocal balancing things. And so we did, So the only time I wasn't there was, I think, 2:30 in the morning. I was like, I love you, but not that much. So then afterwards, on Monday, he would still be in the acute phases of like quasi wound healing. All right, talking scientifically.
Sure.
So we brought him back in. And we did acoustics, we did aerodynamics again. Noticed some changes in his voice. We looked with the strobe light, everything was cool. But that narrowband imaging, yeah, we noticed a change. We noticed a lot more blood vessels.
I get it.
So then, after that, he was on modified voice rest. And every 20 minutes, he was doing these... It's basically blowing into a straw, making sound.
Okay.
Ooh, and humming for about 4 or 5 minutes. In between, it was a little bit hard because he was doing radio shows. Yeah. Too. You know, everyone wanted to talk to him.
Of course.
But I was always like, voice rest, voice rest, voice rest.
Wow.
And then he came back like 2 or 3 times, and yeah, everything's good.
It just seems. He was here, and I don't know, on his show he announced he was going that, or told me privately. I think it was private, still wasn't announced he was going to do it. And I said, what? And he goes, yeah, I'm going to rap for 31 hours. I'm like, or more. I said, yeah, okay. He goes, no, I'm going to do it. I said, wait, for what? And he goes, well, it's the Guinness Book of World Records. Oh, I said, okay, so there's a purpose behind it, and then he said, do some charity work too, as he always does. And first thing I said was, I don't know anything about this, but you better get some medical help or some kind of. No, that was my first advice to him.
You're so right, and so kudos to you and kudos to him to realize that you need some help with this, because I was geeking out on a scientific level because our research is like 30 minutes of vocal loading, we have numbers with teachers are our number one patient population.
That's interesting.
And they've
not singers.
No, teachers, right? And actually,
lecturers and so forth.
Yeah, teachers, music teachers, clergy, music worship leaders, right? So anyways, with teachers, there is some research where they've walked around for 8-hour day with something called a dosimeter on their throat that records how frequently their vocal folds vibrate.
Interesting.
Okay, so for an 8-hour day, I think this is right, it's about 1.3 million times the vocal folds are vibrating.
Okay.
So 31 hours.
Right.
He's a walking miracle.
Right. I get it.
Truly.
I get it.
And every break, we were doing these things because we've shown in human subjects that by doing these humming, they're called semi-occluded vocal tract postures, all that, the vocal folds vibrate in a really healthy way and ostensibly decrease inflammation. Okay. And we know this
without medicine.
Without medicine, steroids and stuff. So this is still a little bit in its infancy, but the voice world has really found out this information from orthopedics. So it used to be when you had knee surgery, hip surgery, let's say knee surgery, you'd be in traction for days, sometimes weeks. Right. And it used to be when you had vocal fold surgery, you'd be on voice rest for a week or 2 weeks. And then the orthopedic people found that, if you start moving really fast after your surgery, it actually decreases inflammation and helps the healing process.
Got it.
Same thing with electronic toothbrushes. The periodontist will tell you to use Sonicare, and you're supposed to put it at an angle up into your gums and move it, how it dings every, it's 2 minutes, right? And just gently move it. And what that's doing is vibrating and moving the gum tissue to decrease inflammation so we don't bleed. Right. So we've taken that physiology
Okay.
and applied it to the vocal folds.
Got it.
And so now when patients go through surgery, we may not wait. Well, we don't. We don't wait 2 weeks of voice rest. We wait 5 days, maybe 3 days based on research. And so with Frizzy, he's not having voice, surgery, but by doing all of these types of tasks, ostensibly decreasing any inflammation that was happening prior to his break.
Right.
That was a long way of saying
No,
that. Does that make sense?
I get it. It does make a lot of sense.
Yeah.
Yeah. I want to go back and get a little history on yourself. Like, how did you get here? Like, what was the path you took? And you're Canadian, right? And you grew up in Ontario? Is that correct?
Toronto. Yep.
I mean, you were. I'm sure you weren't in 6th grade and go, I'm going to be a speech pathologist, and I'm going to. I mean, or did you?
No.
I've heard crazier stories.
Yeah. No. That'd be awesome. My parents would probably be like, "Oh, great! We don't even have to think, and she's just gonna go." No,
Never that easy.
I was very confused. I'm a singer, and
Right,
so
right.
So going back to high school, I sang a lot,
Right.
and well, can I go back to high school?
Go all the way back.
All right. So, all the way back to high school, someone at Maytime Melodies at North Toronto Collegiate Institute heard me singing and knew a German producer that worked for Capitol Records,
Right.
who lived in Muskoka, which is north of Toronto. It's cottage country of Ontario. And so I got in.
Suburb for us Americans.
Yeah, suburbs. It's 2 hours north of Toronto. Anyways, beautiful, area. So I got into Queen's University in Kingston, Ontario,
Right.
and did a double major in psychology. Okay, my love, and vocal performance. And anyways, so I sent him a tape back then. And to make a long story short, when I was 19, I had a recording contract with Capitol Records, and so for a year, every month they would have a limo from Kingston, Ontario to Muskoka, but 6 hours, and I would go and I would record. And I knew, I sang. I always sang, but I didn't really have any training.
Was it pop music?
Yeah, it was kind of heart. They're trying to make me into a heart salmon.
Okay.
Anyways, and to make a long story short, I had a stage name, Jacqueline Solo.
Ooh, there you go.
Yeah, I was going to be a Breck girl, and I remember. Do you remember that shampoo? And so it was like all, we're going to go and we're going to tour, and so
Yeah.
I had a very frank conversation with my parents. I'm an only child, and basically decided, if I'm going to go into music and singing, it's going to happen, but I'm going to get my degree first.
Right. So you're pragmatic at that age, right?
Yeah.
It's a pragmatic decision that a lot of people don't do.
Totally, and I still am.
Right,
So sang all the way through, and after I graduated, I was going to work for Ogilvy and Mather.
Advertising.
Yes. Yeah. All right. And I had 5 interviews for account executive, and I didn't make it. And so then I was like, what am I going to do? And I decided to travel for a year by myself. I knew a lot of people that had traveled, boyfriend, girlfriend, best friends, and everyone, hated each other by the end. And I was like, no, I'm just going to go by myself. So I worked for a year at Coldwell Banker, a real estate firm in retail, their database, made money. And then traveled, and I sang for money. I cleaned toilets at bed and breakfast.
Let's talk about that. Where did you travel to?
Yeah, so I traveled directly to New Zealand, and
phenomenal.
Oh my gosh, I love
phenomenal.
So I'm Commonwealth, right, from Canada. So I stayed in New Zealand for as long as my Commonwealth visa allowed me, which was 3 months.
Got it.
Traveled North Island, South Island.
Did you hitchhike?
At one point, yeah, I did.
Yeah, right.
Okay, so that we're going. I'm so this is when I was 23. 24. I'm 53 right now. So it was a long time ago. It was safer, right?
Yeah, it was safer then.
Oh, 100% I wouldn't do it now. I mean, I wouldn't allow, if I had a daughter, I have a son, I wouldn't allow him to do it.
Yeah, different era.
Anyways, and I camped and I trekked, and that's what I did.
Cool.
So then I went to Australia and I traveled everywhere except the north west part, which is Kilberry National Park. And met a lot of people.
Did you go over to Perth?
Oh yeah, I went over to Perth.
Wow.
It was awesome. Loved it. And then I went to Fiji, came back through Western Canada. And, I was trying to find myself, 24,
Sure.
Yeah, 24, 23, what do you want to do with your life? And I came back completely confused. Completely.
You did not come back enlightened?
No, I didn't. And so I was like, okay. And there's a business side of me. So then I worked for Deloitte & Touche in executive search.
Yeah.
And I was like, nah, this is not doing it for me. And then I went back to Queens as an alumni. And every university has these counseling services that do Myers-Briggs, and I was like, okay, you guys, figure me out. And what came up was speech pathology.
How about that?
And so I hooked up with wonderful man.
So you basically surrendered to science. You were undecided, right? From an emotional standpoint.
Yes.
Probably confident in yourself, but didn't know what to do, and you surrendered to the Myers-Briggs platform of science personality to see what you would be best at.
Yeah, because I looked at, and they did a whole bunch of other tests. I can't remember them, and then they gave all these job classifications, and the ones that they had in this one of it was speech pathology.
Got it.
And I had an ex-boyfriend who wanted to go into it, and I always thought it was very medical, which is super ironic. We'll get to that in a minute.
Okay.
And I was like, I am so not medical. So I love psychosocial stuff. I love kids. So I actually volunteered for 1 day a week while working at Deloitte & Touche with children, underprivileged children, with a speech pathologist, and I loved it. So I got accepted at Michigan State University, and I was going to work with Ida Stockman, huge in child language.
Right.
And I got there, and I got a singing teacher, because I'm always singing, and I liked the child language part, but I wasn't feeling it.
Got it.
And so my singing teacher at the time, Sharon Radionoff, she had just finished a stint with Bob Sadeloff, who was kind of like the father of vocal arts medicine. And she said, well, have you ever thought of being a voice specialized speech pathologist? And I was like, what? That's like a thing? She goes, yeah, it's a thing. So I went to the Voice Foundation Voice Symposium in Philadelphia every June back in 1991, and then I was hooked. So then I pivoted to voice and did a brief stint, which might seem weird, in actually head and neck cancer. So my PhD and dissertation is actually in patients that don't have a larynx. They breathe through a hole.
How about that?
Tracheoesophageal speech.
Right,
So I love that side of it too, but I pulled more to the voice, professional voice. Then I also love stuttering, which is very voice-like. Then I went down to did my clinical fellowship at the Vanderbilt Voice Center and stayed on there for about 4 years.
Okay.
And then I was a master's level, and you need to be a master's level to work as a speech pathologist. And at that point, I had another little soul search with myself, and Ed Stone, huge mentor of mine, he said to me, Jackie, I'm firing you to get your PhD. Because I'd hit this kind of glass ceiling.
Right.
And I had soul searching because I was like, do I want to get my PhD and work in, and be a professor, or am I going to get out of this and go into business? Because there's that side of me, right? So and then I was like, or am I going to get my PhD in psychology? because I love this stuff. And PhD in psychology back then, I don't know if it is now, but it was like average 7 to 9 years.
Yeah.
And I was late.
It's involved.
It's
Yeah.
involved. And,
Right.
and I wasn't in my 20s. And so I was like, I get my PhD 4 years in voice, and there's a huge voice and emotion component. So,
Right.
I'm not saying I'm a psychologist, and there's a line there,
Mm-hmm.
but in our purview, there's a symbiotic relationship.
Sure.
So anyways, so I did that at the University of Maryland, and then I got a call to be the co-director of the UPMC Voice Center. So I've been here for 17 years.
Wow.
Yeah.
I love the fact that you're very passionate about your work. That came through in your TED Talk. It's certainly come through here today. Are there moments you need to recommend vocal surgery? Have you had patients where...
Absolutely.
How do you determine that, though? Is there a simple way to explain how you determine?
Yes.
Okay.
Yes, there is. The simple way is that if we talk computers,
Okay.
the voice box is the hardware.
All right.
Voice therapy, singing voice therapy, is the software.
Okay.
If I'm a Microsoft and I'm trying to put in a Mac software into a Microsoft hardware, it ain't working.
Got it.
So we video the voice box, and all of the voice therapists, we can call it up anywhere in UPMC,
Right.
and we will show patients this. And bottom line, within one session, if we're not making headway with our behavioral balancing tasks, therapy exercises that we're doing,
Okay.
in 1 to 2 sessions, and the patient's compliant, then they need help with our
So you know rather
colleagues.
quick then.
Yeah,
You
we know
like
rather quickly, absolutely. And then we'll see them on the back end.
Got
So
it.
we'll do pre-op therapy, and if it doesn't work after 1 or 2 sessions, then they have surgery. Then we do postoperative voice therapy, because it's their system, their vocal folds, their instrument has been changed, and there's an area of time that you kind of have to recalibrate in how to use it. So the whole process can take, a couple of preoperative voice therapies, and you have surgery. Then you've got about 5 days, maybe 3 to 5 days of voice rest. Then you've got about 3 or 4 more weekly voice therapies. And then you're back and, gradually reinstating your voice with where you're working. If you're a professional musician, we usually say, singer, we usually say about 3 months you're back in the studio, or you're back touring, or whatever, or you're back singing in the church. You're back singing to your kids. That's the other thing. 10% of our patient population are professional singers.
Interesting.
Defined by that's how they make their money.
Okay.
80% of them aren't.
Right.
But we still want to sing. We still want to sing.
Sure.
'Cause singing is
part of the human experience.
Yes, it's an emotional release. Yeah.
What gives humans the color of their voice, or is the correct word? Is it timbre?
Yeah, timbre.
Timbre.
Yep, exactly. No. Yeah.
Okay, but what gives us that? Is it defined in the vocal cord, or is it the whole? It's the whole thing. The air coming through the vocal cords, the vibration, and then how it articulates through the mouth. Is that also part of it?
Yes, love it. The main part is the vocal tract. So if I start speaking to you right now like this, I've just changed my vocal tract, and it sounds, I haven't done anything really to my vocal folds, how they're vibrating, but I've just changed my vocal tract.
So changing the vocal tract is important to comedians who do impressions, right? Like
Yes.
my buddy Terry Jones is pretty good at doing that.
Yes, exactly. So, no, you're so right. So, this kind of sounds gross, but if we right now
Right.
cut our heads off
Yeah.
above
It's going
our...
to happen someday.
Yeah. Please don't try this at home.
Not in our lifetime.
Right above the level of our vocal folds,
Yeah.
and we whooshed air up, you and I would sound really simple. Very
Interesting.
similar. We'd sound like a buzz.
Interesting.
Bzzz.
Okay.
But what gives you your sound and what gives me my sound is the resonating vocal tract. It's everything north
Interesting.
of the buzz. And that's why there are some people that are just born with, I call it the Sydney Opera House as a vocal tract. You know these people.
I do.
You just hear their dulcet tones like down the hall, and they're not even trying. And they've just got this like rich, gorgeous voice, and you want to curl up inside of. Do you know what I mean? Other mere mortals like myself, we've got to work at it.
Yeah.
But most of it is this vocal tract.
It's funny you said that. My wife's first cousin is Renee Fleming, the opera singer.
Seriously?
Yes, which is we're here in this little mill town, and her first cousin is Renee Fleming.
Okay, so
I met her through obviously being married to Natalie, and she has a voice that if you hear her even talk, it's that exactly what you described. She can be down the hallway, you hear that voice. It just it's different. It carries. It's very articulate, but it's just something you can just tell. She doesn't have to sing a note.
Right.
It's just the spoken word.
Spoken word
shows it.
Yeah,
it's amazing. It's amazing.
Same instrument.
Yeah,
and
it's something else.
It's and some people just have it.
Right.
You know,
right.
Kind of what you're born with. But we can help a lot of singers and a lot of speakers.
Are you a vocal coach? Like, if someone wanted to come and learn how to sing, could you do that?
Yeah, so I'm a I do singing voice therapy.
That's what I thought. Okay.
At UPMC, I don't have a studio. You know, in this profession, we sometimes disentangle vocal coach from singing teacher.
Interesting.
Vocal coaches are amazing, and one of their claims to fame is that they can hear a voice and they pair a song with the voice. So, you know, I used to go to vocal coaches. She's one of our speech pathologists, and Ellen Lettrick. She now works in New York City, and she works with musical theater college audition students in coaching, and she can tell from their sound, this would be a great song for you. Like how it's written, the resonance in it, you would be amazing. Okay, so she's a vocal coach. A voice teacher or a singing voice specialist can do that, but is more the technique, making sure that it's healthy, the patient or the student is not hurting themselves, that sort of thing.
Is somebody born tone deaf, or is that just a thing that we say? You know, we just say that because someone hasn't taken the time to learn how to sing. Do you believe everybody can learn how to sing?
Yes.
You do believe that?
The latter. It's very, very, very rare that people are tone deaf. Very, very rare. So yeah.
That's interesting. So
Yep.
I think as most of us, we take singers for granted. We don't realize what goes, whether you're watching American Idol or listening to your favorite pop album or your favorite rock album or opera.
Yeah.
There's a lot that goes into it, huh? Especially a touring musician.
Right.
That's because voice is an instrument, isn't it?
Yeah, voice is an instrument, and you're a vocal athlete, and it's really hard being a singer, because if you play the guitar or the violin, etc., and you're maybe have a cold or you're not feeling that great, your fingers can still work. Right? You can still hold it. And then you put your guitar, of which you have amazing guitars, you put the guitar, you either hang it or you put it in a case and you put it on the shelf. But with the voice, then you're in a smoke-filled, thing, or you're speaking.
Irony of that, huh?
Yeah, you're speaking above the din, or you have a cold, or you have allergies, or you've got reflux, or you have stress, as we talked about, and it's affecting your throat. All these things. I have another colleague, Miriam Van Bursberg, and I love it. She calls it the voice box is this intersection of emotion, of swallowing, of reflux, of colds, of defense postures. It's just like this amazing intersection, and so accidents happen in intersections.
Absolutely,
there's a reason, right? So you got to peel the onion to find out what's really the cause.
Do you have a couple tips for people that are in circumstances where they they're worried their voice is going to give them away or not serve them well, whether it's an interview, you feel yourself getting tense. What can somebody do in that moment? What could I have done in that moment 30 years ago when I was being interrogated and needed to come off effectively and did not?
Okay. A couple of things. Breathing before you go into the meeting, taking in a breath, holding your breath. Okay, so take in a breath for 4 counts, hold your breath for 4 counts, and then exhale for 6 to 8 counts. It doesn't have to be exactly that. The big point is you want to exhale longer than you inhale, because when we exhale longer than we inhale, it kickstarts our parasympathetic nervous system, which is our chill, which is our rest and digest.
I've heard more big words today.
I know. Sorry.
No, it's
but
great.
It's our chill.
Can you say that again?
Yeah. So our autonomic nervous system is split into our sympathetic nervous system, which is the fight or flight.
Right.
Like, oh my God, I'm going into this meeting and they're going to try and fire me. Right?
Yeah.
And then
that's what happens.
Okay. Right. And it's normal. It's normal. Right. The parasympathetic nervous system is what is called the rest and digest. It's the chill. Okay. And so that's why Lamaze, meditation, yoga, all this breathing stuff is heavy on the exhalation. You want to breathe out more. And so that, in essence, relaxes you. So that's number one to do. And that's what you do before you get in there, right?
Right.
But if you're in there and you start having your voice start to quiver, which happens, talk fast.
Pardon me?
Talk fast.
Talk fast.
Right?
Okay.
So talk fast so you don't notice it. So if I'm talking slow, the quiver is going to come out in the slow.
Interesting.
Right? So that's why with singers, if they're going to audition and they don't, the producer director doesn't tell them what they have to audition with, always audition with a fast song. Because you can get that energy out, right? And you can be like, da, 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 versus, I don't know how to, right?
Yeah.
Okay, so speak a little faster and be animated.
Right.
And use your gestures because that energy is in your body. So, in presentation effectiveness, we say that the power space of a speaker is the face to waist. So use your gestures until you start being like, okay, here we go.
Will that help you?
It dissipates all that energy because it wants to come out.
Right. Why do we do that as humans? Why do we talk with our hands? I mean, we talk with gestures. We do
because we want to communicate.
It's part of it.
It's part of it. And it's awesome. It's beautiful.
It is awesome. I would agree with you 100%. I always find it interesting, that connection between waving the arms and shifting your weight and all that stuff.
Yeah,
like I'm doing right now.
Right.
And trying to be effective in your communication.
Yeah, that's why we do it, and it gives us energy.
Interesting.
Right?
Yeah.
It gives us energy because a lot of people, what they'll do, they're dying inside,
right?
But they'll go into vocal fry and they'll be like, "Hey, Eric, I'm glad to be here. Thanks for inviting me," and they'll go into this vocal fry to kind of mask that they're dying inside because they sound like really cool and chill. Yeah, what's going on?
Yeah, there's no excitement.
There's no excitement. Yeah. Meanwhile, their body inside is like erupting. So let it out.
Yeah. No guests like that yet. After 85, everybody's been pretty energetic and on the ball.
Well,
but you never know, though. You never
know. But I got to tell you,
they could be hiding it too, though.
No, but I have to tell you, you are very. You're calming because you're.
Tell my wife that.
Yeah. Okay. I will. Yeah. No, but you're natural. You're natural.
I like to talk. I'm not a good interviewer. I'm not a journalist. This is just, we're having fun.
We're just having fun. We're just chatting.
I love conversation. And I think that's, we talked off camera. That's the format of what we're doing here. And that we need more of that, right? I mean, as opposed to the stodginess of what came before the web era, right? I mean, everything was kind of real stodgy.
Yes. Yeah, it was. It was stilted.
Well, so we talked a little off camera also about the sound. We're living in the era of the sound bite, and we have for quite a while now.
Right.
You're a person that does a lot of interviews, a lot of press over the course of your career, so you know that you've got to get your your thoughts across. And even the TED Talk, you were limited on time, right? There's a time that we're going to talk about that in a second. But even worse, though, if someone's coming from the local news, they could be there. You know how it works. They could be there an hour, but then you end up getting like a 2.5 minute clip.
Right.
So when you're on the spot and you have to get your message across effectively, any tips for that?
Rehearse. Know it in your mind first.
So confidence. Then.
If you can, know it in your mind first. I mean, I'll be honest with you. I can't tell you how much I practiced, and from content creation to delivery with my TED Talk. Now, I have talked to some TED talkers who say that they just, wung it,
I had one in here yesterday, Gabby, she said, I had nothing scripted. I went on there and just let her fly.
Okay.
That has to be rare, though.
And it has to be
Talks,
rare,
right?
and good for her. The TED Talks, and they will tell you, will literally stop rolling. I mean, so I was 9 minutes, and so the timing is huge.
I bet.
And so for me, I was like, oh man, I got to get this right, because we can all wax poetic,
right?
And it's a motor act. So actually presenting live and rehearsing live, not just reading over a script, is how to do it, because it's a live thing. It's a motor act, speaking. So practice.
Yours was 9 minutes, almost 10 minutes.
It was 9 minutes.
Is that all you get is 9 minutes?
Yeah. So it used to be 20 minutes, and I think that this was a TEDx talk. The TED Talks, not all TED Talks, but it used to be 20 minutes. And now they're going to 12 minutes.
I saw
they're
that.
going to 9 minutes, and they're going to 5 minutes for exactly the same reason that you said, is that the human attention span in this social media age is scary, so scary to me, shrinking and shrinking and shrinking.
We're trying to change that here,
We are. So, yes, exactly. This is, and I think as a speaker coming on your show, the anxiety of going, oh my God, I got to make sure that I say this, is like, I don't have that, because I'm like, we're just chatting.
Yeah. And I've been blessed to have, you're probably the 10th or 12th TED speaker I've had, because it's a good pull for us to find guests, because TED is so renowned, both TEDx Talks and TED Talks. My question is for you, how did that opportunity come to you? Did you need to pursue it? Did they invite you? How does that work? How does TEDx work?
Yeah, so I pursued it for two reasons. The first part, and what we talked about in the first part of this, about how our vocal folds protect us and how our voice can either reveal or conceal ourselves. I say that about 4 or 5 times a day to my patients.
Okay.
So part of my reason to do that was, you know what? If this can help more people, and cool.
Right.
So I actually got in touch with TEDx Pittsburgh, and a shout out to Chris and Bridget Daly, Sarah Coffey. They're like awesome people. And I wrote up that I wanted to talk about voice and emotion. So I pursued it. But the second reason that I pursued it is that I have a presentation consulting practice on the side, where I work with clients on content creation, on visual storytelling, so beautiful, evocative slides, like slide design, love it, and the delivery. And I thought, Jack, put your money where your mouth is.
Absolutely.
And
that's smart.
You do something that is going to make you super nervous. And when you think of it, there's 3, I think it's like the last stats are over 3 million hits a day for a TED and TEDx thing. And I was like, okay, yeah, now Jackie's breath holding. I'm going to do this.
It's a prestigious platform.
So anyways, they granted me the total honor of doing it, and I learned a lot about myself. I learned a lot about crafting the story. So
it was very good. Not
thanks.
pandering to you. It was well done, very well presented, very natural. And that's why I can't imagine you being nervous, because it just came off so just fluid and natural. Most of them do. I think maybe that's just what you said. Most people have really researched this. I mean, not researched, rehearsed it to the point where it is natural. Yeah.
And when you talk to a lot of singers, artists, athletes, it comes off as effortless, but there's been a lot of practice, whether you're a pitcher or whatever you do. So it was fun. And actually tonight at Google we're having TEDx Pittsburgh reunion. So Darius was in the same session.
Wonderful.
We did, so hopefully
tell her I said hello.
I will. I loved your talk with her.
She was great. Every guest on here. My TEDx guests have been really phenomenal, though, because they're people that love to tell their story, or they're passionate about their work. Yeah. Which is why I just love hearing that, because that's the juice of it all for me, is someone being so passionate. But let's revisit, before we end this, let's revisit your entrepreneurial endeavors again. I want to dig in a little bit more about your business.
Yes.
You mentioned the slide portion of it. So you help the client create creative slides that go with the entire presentation. So it's the voice and visual together. Is that right?
Yeah. So my practice is just presentation effectiveness. So it's not public speaking or communication and all that kind of stuff. Right. So I work one-on-one with clients, and I'm also as almost a ghostwriter. So they'll send me their slides, they'll do a presentation, and I'm lost. Like, what's the point? And they know what they're super smart. Right. They're super accomplished. But it's not being communicated. So I work with them, and in different genres. So, and I have to learn their genres, because I've worked in artificial intelligence, adaptive learning, all this stuff. And so once they tell me, I write a script for them and do the visuals, the slide design, and I present it to them. Got it. And I'm like, is this kind of where are you going? And then we go back and forth, but we have a blueprint. So I work one-on-one, but then I do group presentations on content creation, on slide design, and they bring their computers, and I love them to bring an actual presentation, and I'll show them something that you can do cool on, and it's all PowerPoints, like 98% of the market share. Sure. And I'll show them something, and then I'll go, okay, now do it. And then walk around and they do it. And then, I also do the delivery, so the vocals, of course, the verbals and the non-verbals. And the big thing that I find with presenters is either or both is this huge infobesity. They just give tons and tons and tons of information, and there's no transition, there's no story. Right. And the other thing is, every audience member, and even now listening, they're all thinking, what's in it for me? How is this going to change my life?
Our self-interest, absolutely.
Totally. Yeah. But as a presenter, you have to write your story, your content, with that in mind.
And you need to revisit it multiple times. Strongly during the presentation. During the presentation,
and I think that, I've given over 400 presentations, for work, what I do. Right. And I was at the Presentation Summit. It's a big conference, and they were asking some of us, how you got into it. And I put my hand up. I don't know if it sounded so well. And I just blurted out anger. And the anger was that I don't want to sound, conceited is not the right word, but I can't tell you how many conferences, and I'm going to say academic conferences, because that's my world, that I go to, that I'm angry. I'm like, why? You've spent no time on your presentation. Your slides suck. You're not communicating anything. You're wasting my time. Right. I mean, that sounds bad. No. I've paid a huge amount to come to this conference, flown out here on UPMC's dime, and I'm learning absolutely nothing. And so in my world, I work with researchers. I work with surgeons. I'm a researcher, right? And everything's about that article.
Sure it is.
But I say to my academic colleagues, you stand on a stage with, 300 people. And if you can communicate your research, your therapy, your surgery, 300 people, each one goes back to their institution, their university, their medical center, and they go, oh my gosh, you know what? They're like injecting hyaluronic acid into the vocal folds and blah, 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 blah. You're going to reach more people than some journal on an online platform.
Right.
And so my passion is academic medicine, but here's the rub. There's no consequence for poor presentations because there's no money involved.
Understood.
Okay? So it's the business people, it's the marketing people, it's those people that are like, yeah, there's a consequence. If I'm not communicating well, I don't make money or I don't sell, etc. Yeah. So it's kind of interesting.
Everything's a sales job.
Everything's a sales job.
People don't want to admit that, but it's true.
It's true. And it's not a dirty word.
It's not at all. No,
right.
we've turned sales into a dirty word, but it's not.
It's not.
You're marketing, you're presenting, but see, all the best research in the world is worthless if it cannot be articulated and engaging. Am I right?
100%. Amen. Yep. 100%.
This was amazing.
Oh,
did you have fun?
I did. I want to keep talking to you afterwards.
I would absolutely love for you to come back. We're going to do some panel discussions later in the year. We're going to invite different guests with different backgrounds on the show, and just throw a couple social topics out. Nothing political, but just social topics out, and just get different perspectives from different fields of study. And just really find some interesting commonality between the
that's
guests.
cool.
I
love
into that.
that.
We'll be talking about that.
Yeah, I love that.
Yeah. Just and Frizzy's on board. We have musicians and education and medicine, and just it's going to be interesting. So love to have you back.
Great idea. Okay, thank you. All right,
Dr. Jackie, I appreciate it.
Thank you.
We are out. Wait a second. Before you leave, you have to tell us about this project with Frizzy.
Are we on?
We'll do it again.
That's how
we are on.
That's how good you are.
You're not leaving here until you tell us about this project with Frizzy.
Okay. So can't tell you a whole bunch, but we're doing something really, really cool. The Frizz and I, with Music Cares, through the Grammys, and we're kind of joining forces in kind of melding what he does, what I do, to really help the community, the music community, hip hop, rap, speakers in general. It's going to be in New York, and it's going to be really cool. So
when's this coming up?
Don't know exactly the details.
I'm
teasing. I guess this is a tease. I seriously don't know exactly when it is happening, but it is going to be happening.
I gotta call Harvey.
Yeah, call Harvey. No, I called Harvey, and I'm like, what? So, super cool. It's definitely going to be happening within the next three months. So
really, that soon?
Yep. So we'll let you know, and want to help
both of you on the show soon. Here, we're going to do that too.
Yeah,
get you both on the show. He's a character.
Yeah.
All right, that's all she's going to give us right now. We'll take that for now.
Okay. Thank you.
All right, you got it.
Fingertips above the water, you watch me drown. You could have saved me, but you let me down. Yeah.